thank you for being with us today. And I'd like to step aside and give an opportunity for our president-elect candidates to open with a brief statement. So we'll start with Dan Buffington.
Thank you, Michael. Dan Buffington. I practice in the Tampa, Florida area and on faculty with the University of South Florida's colleges of medicine since the early 1990s, and then the College of Pharmacy since its inception. If for those of you that don't know the type of practice that I have, I developed in the early 90s a ambulatory care practice model that's structured more like a medical practice office setting. We are a licensed pharmacy as well. The services span everything from medication therapy management, direct consultations, drug information services for hospitals, medical practices, law enforcement, government agencies, and we do clinical trials as well. So everything about the practice is collaborative in nature and has given me the opportunity to work over the years directly with physicians. So I think many of the challenges that we have as a profession are how do we best integrate and demonstrate our value to others so that they see the full potential of utilizing pharmacists across a wide array and scope of services. In addition, the practice opportunities have given me the opportunity to serve for the last almost 15 years with the AMA CPT editorial panel. That's where medical billing codes are created. We've crafted pharmacy specific codes for MTM for billing, working directly now with payers and various types of government or commercial payers is one of our greater challenges. So positioned to do that. And for the last 5 years have worked directly with Medicare in the Center for Medicare and Medicaid Innovation, helping to manage projects that demonstrate the impact that pharmacists make both clinically and financially on healthcare outcomes. In that process, I feel, and I'm sure we'll address tonight, and we look forward to fielding questions from members as well, that this is an exciting time. There's a lot of people see the challenges that we have, but you're either the glass is half empty or glass is half full. I'm clearly in the half full and looking for how to fill and increase the volume of the glass at the same time. So I think that in the interest, we want to make sure there's enough time for discussion. I would say that a key factor is throughout my career, I've been active in numerous state and national organizations. Previously served as FSHP president, so I certainly understand the dynamics and the requirements of organizational leadership and structure. In addition to that, I served 2 terms on the APHA at a national level, APHA's Board of Trustees, working directly with the spectrum of senior leadership there. And I think that we are respected as a state across many of the other states for our advanced pharmacy practice and the initiatives that we do here. I just think this is an exciting time to continue to expand the scope and impact that pharmacists are able to make through collaborations with physicians and other healthcare practitioners. On that note, Kevin, I'll yield the floor to you.
Thanks, Dan. Yeah, so my name is Kevin Duane. I am a pharmacy owner in Jacksonville, Florida. I own Panama Pharmacy. We have 2 locations here in Jacksonville. I got my start in pharmacy as a technician. I worked at a technician of a chain store for 3 years before I decided that I wanted to go to pharmacy school. And then I went to the University of Florida College of Pharmacy and continued to work as an intern. And then after I graduated, I worked in chain pharmacy and then had a wonderful opportunity to purchase a community drugstore. I've opened up a second one since then. Currently lead a team of 19 pharmacy staff members. The reason why I wanted to run for president of the FPA is simply because, as Dan hit on, the profession is really, I believe, at an inflection point. There are parts of the profession right now that greatly worry me. Pharmacists everywhere, I think, or in this state everywhere, are feeling the pinch. We have independent community pharmacies closing at a rate of, I believe it is 1 in 7 pharmacies over the past 4 years have closed, independent community pharmacies. There's tremendous contraction in the space right now. It worries me because in this state, we have multiple pharmacy schools. We're graduating about 800 new graduates per year. there's 21,000 pharmacists in the state of Florida right now, and the Bureau of Labor Statistics says that the demand for pharmacists in Florida will be flat over the next 10 years. So that greatly concerns me because I don't know what kind of future our profession holds unless we do something about it. So for that reason, I wanted to be the change that I want to see, and that's why I decided to run. In addition to running the 2 stores that I have, I'm a member of CPESN. I'm a leader, luminary with CPESN. So that's, if you don't know what it is, it's a very innovative practice model. It's a way that we can go beyond the fill and market our services as clinicians in the community, partner with physicians and payers to provide value to the healthcare system in ways that we previously have not been able to. It's a way to move away from product dispensing, a product-centered model, and into a clinically centered model. I'm also a preceptor for pharmacy students with several colleges of pharmacy. University of Florida is a large one that I have. We also have a community residency program that I'm very proud of that we started this year with the University of Florida. So I think that my practice is very innovative and it's very ideal, but I know that that's not everyone's practice. And I know that in Florida, there are some real issues that we have. Chain pharmacies are having their staffing hours cut. New grad pharmacists are coming out with debt loads that are well above anything that we've ever seen before. Meanwhile, chains are slashing the amount of pay that they offer. They're slashing the amount of hours that they offer. Certain chains haven't given cost of living raises in this state in 4 or 5 years. We have technicians who are leaving the field to go work as IT or other trades simply because the job wage doesn't support it. We don't have any kind of advanced technician model or certification. Technicians are having their licenses suspended because their student loans are not in repayment. Meanwhile, there's no representation or technician by their peers on the board of pharmacy in the state. So I think that there are things that I see with this profession, having been in this profession, you know, first as a technician, moving up through intern and pharmacist, pharmacy manager, and owner, that concern me and that I think should concern everyone in this state. While I am able to be on the forefront and have a lot of innovative practice models, I know that not everyone has that opportunity or is fortunate enough to work for an employer that allows them to do that. So I want to join the fight with you all to expand, protect, preserve the practice of pharmacy in the state of Florida.
Thank you, Kevin. Thank you, Dan, for your opening remarks. And so for now, for the attendees that joined in late, this session is being recorded. It is going to be made available on our website. Hopefully by tomorrow, you'll be able to see the responses. Also, everyone should be in listen-only mode. So if you have comments that you would like to share with the candidates, there should be a chat room option so you can make your notes there. So the first question we want to pose to the candidates is, what is the single most important issue that our profession needs to address over the next 5 years? And we'll start that out with Dan.
Thank you. I have multiple, but giving the priority, I would say at the top of that list is the fact that we have excellent training, the fact that we have many great services across the state of Florida that are pharmacist developed and pharmacist driven. One of our key issues is to be able to demonstrate that return on investment or ROI value, because at the core of business decisions, whether it's Medicare and Medicaid or whether it's commercial payers, is to have people fully understand what value we bring clinically and financially, and the impact we have on health outcomes. So it's not really a scope of practice. We already have excellent scope of practice, but we really have to train pharmacists, new pharmacists, young pharmacists, but established as well, how to go beyond the daily activities that we do, but to be able to compile that data in terms of outcomes and demonstrate that back for payers and other healthcare entities and infrastructures to be able to see the value that we bring in and fully utilize this to the top of our license.
Thank you, Devin. Kevin.
Yeah, so I agree with Dan that, I mean, demonstrating the return on investment that a pharmacist can have as part of the healthcare team is something that's very important. As a luminary in CPESN, that's something that I definitely deal with every day in my practice. Um, the scope of practice, I think we could have some improvements in the state of Florida. I think we're one of only 4 states that only allows pharmacists to vaccinate people that are 18 years of age or older. So one of only 4 states where we only allow that, and I really think that we could have some improvements in that. But as far as the question goes, the number one thing that is affecting the profession in our state over the next 5 years is without a doubt pharmacy benefit managers. If you're a technician and you're the only one working in your chain pharmacy for hours at a time, it's because your pharmacy is being squeezed by PBMs and your chain does not have enough money in order to pay for more technicians. If you're a pharmacist that's having to stay late or come in early or come to work on your days off in your pharmacy, the reason is because PBMs have affected your reimbursements to the point where they're asking you to do more with less. If you're an independent community pharmacy owner, you already know what PBMs are doing to you because maybe you've closed your stores. Like I referenced earlier, 15% of stores in the past 4 years have been closed. So without a doubt, notwithstanding the fact that, as I said before, we graduate 800 new pharmacists in the state every year. If we want the jobs, and the job market is projected to be 0% growth in this state over the next 10 years, if you want the jobs to continue to be there and the revenue needs to be there in order to create new jobs, then this predatory middleman that does nothing for the healthcare system except for extract dollars from it is absolutely, without a doubt, the number one issue in this state over the next 5 years.
And thank you both, gentlemen. We appreciate your response. This next question will be directed at Kevin, followed by comments from Dan Buffington. So most pharmacists and technicians are not members of a professional organization. Please share your vision on how the Florida Pharmacy Association can be the advocacy home for our stakeholders.
So I think that the majority of I think that our membership outreach has to be in a way that our members can connect with it. And I think that social media will play a big role in that. One thing that I would do to drive engagement with pharmacists and technicians would be to engage with them on the platforms where they are. Direct mail and email aren't as relevant these days to people as things like Facebook, Twitter, Instagram, Snapchat. So I definitely interface with them. But I mean, the bottom line is you want to get return on your value of your membership. So I think that things like CE programs, as a community pharmacist, a CE program that would show me a review of disease states for bipolar and schizoaffective disorder may not be as relevant to me as something that could show me innovative practice models, value-based pay, shared savings models, teach me ways that I could improve my practice, bring more money into my practice that I could then use to invest in myself. And that's not just community pharmacy owners. I know there's a Brad Tice with Aspen RX Health, for example. He goes to social media and you can join and do MTMs on your own and make money as kind of a freelancer. And that program was shown to me through social media channels. So I think that just engaging with a member, showing the member the value for their membership will naturally lead them to see the benefit in such a membership.
Thank you. Dan.
Sure. So I see a distinct difference between member engagement and member expansion. And I think that the optimal way for member expansion is by enhancing actual member success. So I do think there's an element of academic and continuing education platforms that are not just designed to be a clinical topic, but that are there to help educate active practitioners, young and established, on what are their options in the current marketplace, integrating with various types of health systems, interdisciplinary practice models with physicians. But I think that we have to, while PBMs in the previous discussion was key, we have to take our focus off just product. PBMs have to be reined in and should not be allowed to operate outside the construct of regulated healthcare. But we've got to teach pharmacists how to practice in a manner that goes beyond product. So that's where I see the member expansion and member growth and engagement is by actually being able to impact the success and the career opportunities of pharmacists that are practicing in Florida today.
Thank you, gentlemen, both. You're doing excellent here, and we appreciate your time for tonight. For this next question, Dan, we're going to start with you. It is known that students are very active in their professional associations while enrolled in school, but upon graduation, they are lost to the pressures of their career development. What measures do you believe that the Florida Pharmacy Association should consider to help with retention of recent graduates as members?
No, it's a critical issue, and it's not new. This is an ongoing issue. I think that in this particular case, we've all been there. We've all, practicing pharmacists have all been that new graduate. You go from the excitement of school, where it's a coordinated entry point to see what your career opportunities are, and then you get busy in the workforce. I think the key issue here is mentorship, and I think that while we do a great job of experimenting with mentoring and supporting students for certain state meeting activities, I think we need to do a broader job at networking new graduates, existing graduates, and young practitioners into relationships with established or seasoned practitioners that go far beyond just here's how the practice works. It's opening doors, mentoring, and helping them network for career opportunities. And I think, again, that brings back the value of being a member.
Thank you. And Kevin?
So I think for me, I think that what would most engage new practitioners with the association continuing from school is that I think that the functions and the performance of the association have to be tailored to their practice site. I think that in this state right now, BLS shows that 43% of pharmacists practice in a community setting. So the concerns of the association should be the concerns of the most dominant member of the association. And if that is the most dominant member of this state, then that's community retail pharmacists. And I think that right now they have grave concerns about metrics. You have pharmacists that are being reprimanded for not answering the phone quick enough or not selling enough discount passes and things like that. And I think that as a new practitioner, I would want to know, what is my association doing to aid and assist me with those types of things? I want to know that my association is in tune and attentive to those kinds of things, and that will show me that the association cares about me and that the association is willing to go to bat for me, and I would be willing to stick with the association. So I think that's what it is. We have to be in tune with the dominant membership model right now.
Okay, thank you so much. This next question, we'll start with Kevin Duane on that. It's a short question. Describe what you see as the Florida Pharmacy Association's greatest strengths and weaknesses.
Okay, sure. I think right now the greatest strength of the Florida Pharmacy Association, I would say, and the experience that I've had with it would be the CE programs. I've been to several of the CE programs, and I can't speak for all of them, but the ones that I've been to have been informative, and they've been topical, somewhat relevant, even if not to my particular practice setting. So I think that the biggest weakness that the association has right now is I think that at times the legislative advocacy efforts are not truly aligned with the majority of its membership. I think that, for example, test and treat right now is something that the association is advocating for. And while I think that's great, I think that if you asked a typical member of a chain pharmacy, they would tell you, hey, test and treat is something that sounds good in practice, but worries me because I already don't have enough staffing and hours to do everything else that my work asks me to do. And now this will just become something that a corporation twists into a way to earn stockholders more money and not me. So I think that at times the legislative efforts with the association can be misplaced with the bulk of the members and the practitioners in the state.
Okay, Dan.
Michael, your screen froze for me, so I didn't hear the whole question. Could you repeat it?
I'll be glad to repeat it. The question is, describe what you see as the Florida Pharmacy Association's greatest strengths and weaknesses.
So strength, I think, is the historical platform for networking and engagement. FPA and FSHP together have had very strong working relationships, and I think serve as that basis, that community, where I think the weakness would be is similar comment to Kevin's, is the alignment of resources and focal point on those topics that are going to impact the future. So scope of practice is clearly an issue, but our relationships outside of legislative activities with physicians, whether it's the FMA, FOMA, and other groups, are that ally building that at a state level, but also at a point of care in the field level, are where we build that support within the physician and other allied healthcare communities. So I think we've got a lot of work and opportunity to continue to build allies across other health professions.
Okay, thank you, Dan. The next question is, there is new concerns regarding the employment marketplace for pharmacists these days. Tell us what you believe are the solutions to job growth now and in the future for both pharmacists and pharmacy technicians. And we'll start with you.
Sure. So this is what I've spent my entire career doing, and that's looking for advanced practice alternate models that are not product focused. I think that our success and our future are outside of product. Does that mean to divorce or reduce our administrative oversight over product? No. No one in the entire healthcare profession has the depth and breadth of training that we have, and there's safety issues, clinical factors, but helping to develop practice models that are service-based, like in ours, that are cognitive service activities that don't depend solely on product transactions and product-based revenues, are where it's a wide open opportunity for pharmacists now.
Okay, thank you. Kevin.
Sure. So I think that I agree. Alternate payment models and value-based pay, that's where the pharmacist as clinician goes. That doesn't mean you have to remove yourself from the community setting. It just means that what you will do is different than a product-based dispensing model. And I think that dovetails very nicely with the second part of your question, which was about technician expansion. And inherently, the more things that technicians can do, the more time the pharmacist will have to expand on some of these shared savings, alternate payment models. So I think, for example, as a CPESN luminary, I do this every day. I work with my resident pharmacist. We do e-care plans every day. We are demonstrating a model that is not a product, putting the pills from the big bottle into the little bottle model that pharmacists are good at. But in this state, we don't have, for example, any way for advanced technicians to be recognized, technicians that are nationally credentialed. Other states have that, and that's something that if we're going to move pharmacists away from a dispensing-based model and into a collaborative, aligned model with physicians and other healthcare practitioners, inherently, you also have to fight for increased technician role and the certifications, credentialing, and payment that will come with it.
Okay. Thank you so much. I appreciate that. Gentlemen, I think we're getting close to the wrap-up time period for our discussion tonight. We allocated 30 minutes for this session. I do have a question in the chat room that I want to share with both of you gentlemen. And there's a thought on prescription vending machines or automated pharmacy systems. There's a piece of legislation that's being discussed now in the legislature that passed last year. Could you share us your thoughts on that particular issue? So Kevin, we'll start with you.
Sure. So I think that the dispensing machines started off as something that is very noble. They wanted them to be in emergency departments, dispensing several days worth of antibiotics in rural areas where a pharmacy was impractical to be built and staffed 24 hours a day. I think that they have a place in that role, but very narrowly in that role. I think that anytime you remove the practitioner from the interaction, we have seen leads to worse outcomes, whether it's a mail order that is an 800 number and a UPS delivery for your medicines, or something like, you know, now we're seeing things like drone delivery, and it's just not a model where JAMA had a paper posted, and in JAMA it said that when a community pharmacy closes, hospitalizations go up, medication adherence goes down. And that's not always because there is a complete lack of alternative options to fill medication. There's always things like mail order and things like that. It's because of the touch that the corner drugstore community pharmacist has. And I think that we have to be very careful when you compromise technology. You have to think about a continuum of quality and access. And I wonder if that kind of technology lends itself too far to the access side and too little on the quality side.
Okay. Dan, your thoughts on that question?
I appreciate the opportunity to hit this one. I am diametrically opposed to this on multiple levels. I think that we have to be very careful is that telehealth is not automation. Telehealth is still a direct relationship with the patient and a practitioner. Automation is simply a cost savings attempt or strategy with someone trying to use a device instead of a practitioner. The arguments that you can have kiosk access doesn't replace or support the same level of interactions that you can have. I think that we need, this comes back to my starting point and what I think was answered, Michael, your highest important issue. We have to take those facts that are the return on investment value of what we bring for clinical and financial. And that should be, if someone presents this as a rural issue, an after hours issue, those are challenges back to us as a profession to say, we'll solve those. You don't have to circumvent what we do with an ATM of medications. So I don't think physicians would support the same concept with regards to their services. It's actually not a healthcare service, it's a commoditization. It's turning the focus into the dispensing of a bottle. That's exactly what we're trying to avoid, is the profession being perceived as a dose in a plastic bottle. It's got to be that your access for healthcare and optimal health outcomes comes through the relationship with the pharmacist. If you have after-hour needs or rural needs, these are things that we can solve, not look the other way and be abused in the process.
Okay, thank you, gentlemen, both. Wish we had a lot more time. I've got one more question I need to ask, and there are two very interesting questions that are in the Q&A session there. Perhaps the participants who pose those questions will send that to you in an email if you all would be willing to share your email addresses with those who are on the call. So the last question I'd like to pose to you, and then we'll give an opportunity for each of you to have closing remarks. What would each of your presidential themes be and why? Let's start with you, Dan.
Okay, so I don't know that I've refined it, but I would say just based on the type of practice that I have, based on the passion that I have for helping craft advanced practice models and reimbursement and working with federal agencies to see the impact and use pharmacists at a greater level, I think it's the world beyond product. So our history and our basis is critical. But as we've said numerous times tonight, Kevin and I have both echoed that the future for our profession goes beyond product. It goes beyond product handling. It goes beyond product remuneration and reimbursement driven activities. And we have to steer our profession towards these models where we're utilized as a clinician and still have that professional oversight over product and medication utilization. Okay,
thank you. Kevin.
So I hope that it's not too corny, but I think I'd go with something along the lines of prescription for change. And I really think, I mean, I agree, the pharmacist as community clinician is where we're headed. But in the meantime, if you're one of the 800 graduates that are coming out in this state every year, if you're one of the 40% plus senior pharmacists that Walmart laid off last year, you can't wait for that. So I think that my presidential theme would be, what change can we enact? Two-part. The long-term change that will ultimately be the dominant profession in the state. But the short-term change, what can we do to help the chain pharmacist that's coming in on their days off and staying late every day? The technician that would rather go work at a car dealership than a pharmacy because they can't get the payment at their job because they don't have any kind of senior or advanced credentialing. So I think that in that way, my theme would be a theme of change.
Thank you so much, gentlemen. And we're at the bottom of the hour now. I want to give each of you an opportunity to do closing remarks. And then that will be close to the end of our webinar. So if we can allow you 90 seconds each to share us your final thoughts before we end tonight's session. We'll start with you, Kevin.
Sure, thank you. I appreciate everybody listening to us today. I think that both of us had some really great points. I think that pharmacy overall is at a really exciting time, but it can be a very scary time too. I started in pharmacy as a technician before I had any thoughts about going to pharmacy school. So I've been in this setting for a long time, and I've been in the trenches, I've worked in those jobs, and I've seen what has happened to the profession. And I know for a fact that in this state, there's a lot of progress that we need to make. And I'm on the front lines every day, and I know that I can be the person that can help enact that change. Thank you.
Thank you, Kevin. Daniel.
Yes, sir. So I would just say, first of all, again, thank you for everybody who's gotten on tonight. When we talked earlier about member engagement, it starts here. You guys are taking the time. Those who will log in and see this later are individuals and fellow colleagues that are interested in what direction our association is going, what's critical or important factors to future leaders in the organization. I just feel that at this point, we have many opportunities and doors that are there to open, but we need to work with payers. We need to work with medical associations. We need to work with CMS and CMMI to affect the changes that optimize our ability to be reimbursed at a greater level for clinical services beyond the product. And in doing that, I think those are the values that I bring in terms of immediate opportunity for leadership, is experience in each of those areas and years of relationship building. And in that, I would appreciate your support and vote, and encourage that everyone who's on the call tonight to ask another colleague whether they're a member or not to see this, and to voice your interest in being more engaged in the future in FPA.
And thank you both, gentlemen. Would you like to share your email addresses for the panelists?
I would. Do you have those that you can post, or you want us to read them?
You just go ahead and read them off, because it's going to be recorded.
Kevin at PanamaRx.com.
Okay, Dan?
And Dan Buffington at CPSHealth.com.
Okay, thank you, gentlemen, so much. For
So
those
thank
of
you,
you
Mike,
who
for
are,
moderating.
yeah, and for those of you who are attendees listening in, don't forget the voting system is now open if you have not voted already. There will be reminder messages that will be sent out by the system to go ahead and vote. The last day to vote is January 31st of 2020. We hope that you all participate. Again, thank you, gentlemen, so much for being with us tonight. Thank all attendees who have been with us tonight, and hopefully everybody have a pleasant evening. Thank you so much.
Michael, there was a request that just came through the chat to repeat the emails. Kevin, do you want to repeat yours?
Yeah, Kevin, Kevin at PanamaRx.com, PANAMARX.com. Thank you.
And mine is Dan Buffington, no separation, at CPS, like Charlie, Paul, Sam, and health like in healthcare, CPSHealth.com.
Okay, and thank you so much. Ladies and gentlemen, we are done, and everybody have a pleasant evening.
Thank you.